We are in the process of reaching a conclusion and debating at least the first step of, maybe now the second step of reconciliation, an opportunity for us to make the tax code more permanent, an opportunity for us to reduce spending and to hopefully get the budget better in balance, to bring our debt under control. But today I just want to highlight a small portion of what this debate ultimately will consider, and that's the issue of Medicaid. Mr. President, I come, as you do, from a very rural state, and Medicaid is a component of how we provide health care to low-income individuals and how we care for and provide medical care and treatment for those with disabilities. And I want to highlight from my own personal point of view how valuable that is, the necessity of us finding ways for low-income individuals and individuals with disabilities to be able to access health care. And as this conversation and debate continues, I want to make certain that my colleagues know, in my view, the value of making certain we do no harm to those in desperate need of health care in Kansas and across the country. I'm certain, perhaps without a doubt, there are flaws in the system and abuse that occurs, and our focus should be on eliminating those flaws and that abuse. And Mr. President, I want to also talk about another aspect of Medicaid funding. A lot of what I've worked on as a United States Senator and before that as a member of the House of Representatives is trying to make certain that rural America, rural Kansas in particular, has a future. That the community that I grew up in, now population less than 2,000, has a future, an opportunity for people to come there, live there, raise their families there, educate their children there, to retire there. Rural America is hugely important to me and, in my view, hugely important to the country. One of the challenges we face in rural Kansas and Kansas generally is access to health care. And our community hospitals are hugely important. Our ability to maintain those hospitals and keep their doors open is a major priority for me. During COVID, we took extraordinary steps to make sure we didn't lose a health care provider and that the citizens of Kansas and the country could access health care. One of the components that that pays for that health care is Medicaid. It's not the hugest component. Medicare, private insurance, other sources, private pay are utilized for the hospital to generate the revenue to keep their doors open. But this keeping of hospital doors open matters. As I stated, my goal of making sure that rural communities have a future, that future disappears in the absence of access to health care. And so a significant portion of that effort of mine to preserve, protect, and defend rural Kansas, and our state generally is rural, is to make sure that the hospitals have the capability, the revenues necessary to provide the services that the community needs. Medicare is a component of that. 9% of hospital revenue, 9% of hospital revenues come from Medicaid. It's also true that Medicaid only covers 65% of the costs of the health care provided to someone who receives Medicaid benefits. The average operating margin for a Kansas hospital is a negative 7%, meaning that the revenues don't cover the costs. And there's $1.1 billion in uncompensated care. In other words, the hospitals of Kansas, our healthcare providers, have a shortfall. They take in a certain amount of revenue, but that revenue is $1.1 billion for uncompensated care. That revenue doesn't exist. 8 hospitals have closed in our state since 2015. I've visited every hospital in Kansas, most of them numerous times. I've talked to hospital administrators and patients and board members and the CFO. And one of my standard questions is often, so are you in the red or the black? And the most common answer to that question is, well, depends on what day you ask. My point in making these statements is that as we debate reconciliation and as we debate the instructions, in the case of the House, instructions to the Energy and Commerce Committee, and in the Senate, instructions to the Finance Committee, those instructions in the bill that we're considering right now are significantly different. The instructions to the House Energy and Commerce Committee is to cut $888 billion from Medicaid. The instructions to the Senate Finance Committee is to cut $1 billion. Now, these are both, in both these circumstances, these are minimum amounts. But I wanted my constituents to know that, in my view, before this product is concluded, before this legislative endeavor is included, and we've sent the instructions to the committees, and the bills come back from the committees, I want to make sure that we take into account the importance of people who are low income and have disabilities, and the importance of Medicaid to them, but also the broader issue of what it means to a community to lose its hospital. Often that hospital is the largest employer in communities across Kansas. That's a component, but the reality is that our citizens move away. If you're a young family and you're looking for a place to live, or you're a young family that has grown up in a community in the absence of access to health care, and it's broader than just hospitals. It's the hospital, it's the nursing home, it's the community pharmacist, it's the physician, it's the nurse practitioner, it's the chiropractor, it's the optometrist. All those individuals and their professions matter to whether or not communities across my state will be around for time to come. I want to highlight this issue today because the process is beginning that will set the stage for whether or not the future is bright for individuals and the communities they live in Kansas and across the country. Mr. President, I yield the floor.